Are you concerned about the potential of a new pandemic that could be 50 times more dangerous than COVID-19? Well, get ready because that nightmare scenario may be unfolding right now. Global health authorities are on high alert as a concerning new virus outbreak is spreading. This virus has the potential to become the next global health crisis, and we all need to pay close attention. In this video, I'm going to share the critical details you need to know about this emerging threat. I'll explain what this virus is, where it's been detected, why experts are so worried, and what you can do to protect yourself and your loved ones. This is important information that could save lives, so make sure to watch until the end. The virus I'm referring to is the H5N1 avian influenza virus. This is a type of flu virus that primarily infects birds, but it has the potential to jump to humans and cause a devastating pandemic. H5N1 was first detected in domestic poultry in China in 1996, and it has since spread to many other parts of the world. While it doesn't spread easily between humans at the moment, health officials are extremely concerned that the virus could mutate and become highly transmissible between people. If that were to happen, we could be facing a global health emergency unlike anything we've seen in modern times. So what makes H5N1 so dangerous? Well, for starters, this virus is incredibly deadly. The current mortality rate for humans infected with H5N1 is around 60%. To put that in perspective, the mortality rate for COVID-19 was estimated to be around 2%. This means H5N1 is over 30 times more deadly than the virus that caused the recent pandemic. Additionally, H5N1 appears to be able to cause more severe illness in humans compared to typical seasonal flu viruses. Many of those infected experience very high fever, cough, sore throat, and muscle aches. But the real trouble comes when the virus starts to affect the lungs. H5N1 can rapidly lead to pneumonia, acute respiratory distress syndrome, and multi-organ failure. Without prompt and aggressive medical treatment, the prognosis for those infected is quite poor. Another major concern is the potential for H5N1 to mutate into a strain that is more transmissible between people. Up until now, most human cases have resulted from direct contact with infected poultry. But if the virus were to undergo certain genetic changes, it could potentially spread more easily through respiratory droplets or even airborne transmission. That is the nightmare scenario that keeps global health officials up at night. The good news is that so far, there have been relatively few human cases of H5N1. Since 2003, the World Health Organization has confirmed around 860 human infections worldwide, resulting in over 450 deaths. Most of these cases have been concentrated in just a handful of countries in Asia and Africa, where the virus is endemic in poultry populations. However, the situation appears to be worsening. In late 2022, there was a concerning spike in H5N1 detections, with over 200 human cases reported globally. This included the first ever human cases identified in South America. Outbreaks have also been observed in wild bird populations across Europe, North America, and other regions. Health authorities are deeply troubled by these developments, as they suggest the virus may be spreading and adapting in worrying ways. To make matters even more concerning, H5N1 is not the only avian influenza virus that has pandemic potential. Other subtypes like H7N9 and H9N2 have also jumped the species barrier and infected humans, although not on the same scale as H5N1 so far. The more these viruses circulate in birds, the greater the chance they could evolve to become better suited for human transmission. Why are experts so worried about this? Well, the impact of a potential H5N1 pandemic would be catastrophic. Based on modeling and simulations, a severe H5N1 outbreak could lead to tens of millions of deaths worldwide. The economic and societal disruption would be immense, dwarfing even what we experienced with COVID-19. Health systems would be quickly overwhelmed, with hospitals running out of beds, equipment, and medical staff to care for the huge influx of patients. Supply chains for essential goods and services would be disrupted. International travel and trade would grind to a halt. Lockdowns and other restrictive public health measures would likely need to be implemented on a massive scale to try to slow the spread. And unfortunately, we may not be as prepared for an H5N1 pandemic as we were for COVID-19. There are currently no approved H5N1 vaccines available for widespread use, and the development of effective treatments has been challenging. Existing flu vaccines would provide little to no protection. Global manufacturing capacity for any new H5N1 vaccines would also likely be quickly overwhelmed. So in summary, H5N1 has all the makings of a potentially devastating global health crisis. The virus is far deadlier than COVID-19, has pandemic potential, and could overwhelm health systems worldwide. And the threat appears to be growing, with worrying signs of increased spread and adaptation in recent months. That's why health authorities around the world are sounding the alarm and urging vigilance. Governments, businesses, and individuals all need to start preparing now in case the worst-case scenario unfolds. Robust disease surveillance, supply chain resilience, and public health emergency planning will be critical. At the individual level, there are also steps you can take to protect yourself. Practicing good hygiene, avoiding contact with sick poultry, and getting vaccinated against seasonal flu can all help reduce your risk. It's also important to stay informed and heed any official guidance or warnings that may be issued. While the prospect of another pandemic is undoubtedly concerning, knowledge is power. By understanding the threat posed by H5N1 and other avian influenza viruses, we can work together to mitigate the risks and hopefully prevent the next global health catastrophe. Pay close attention to this developing situation, and be ready to act if the need arises.